public health, because most students in the United States never do. Currently, there is a widespread epidemic of health illiteracy and a lack of public health education in elementary schools across the nation. Schools currently lack curriculums that teach public health to elementary school students in a systematic and comprehensive manner, and many state health standards only list general health requirements that focus too much on the human body rather than community health or disease prevention, which are equally as important. An estimated 80 million Americans are health illiterate, and millions more people are dying of preventable diseases because of this. However, there is hope. Instilling healthy habits in children from a young age can reap long-term benefits, such as improved health behaviors and reduced healthcare costs. Therefore, it has been my mission to bring accessible public health education to elementary school students and spread public health literacy among youth.
Hi, my name is Melody Chang, and I'm currently a senior here at the Orange County School of the Arts. My project is called Let's Learn About Public Health. That's me, not the old woman on the couch, but the doctor checking her heartbeat. While this may seem like an innocent child's game, this was my introduction to public health. You see, growing up, I witnessed my grandma's lifelong battle with hepatitis, which is a 100% preventable disease that she unfortunately still contracted because she lived in an area where there was no access to public health information. Through this experience, I recognized the life-saving importance of spreading public health literacy. Now for a quick question. How many of you guys know what hepatitis is, just by a show of hands? Okay, great. Now keep your hands up if you know what hepatitis does to the body. Seems like there's some hesitation in the audience. So, let's learn about hepatitis. Hepatitis refers to the inflammation of the liver, which is the largest solid internal organ in the body. Hepatitis is one of the leading causes of liver cancer. However, it can be 100% prevented by getting vaccinated and not sharing bodily fluids. Congratulations, you guys have all completed your first lesson of Public Health A to Z for Youth, a book I wrote upon recognizing the lack of children's books about public health. About a year ago, I delved into a long journey of researching, writing, and publishing this book. Because my target audience was 3rd through 6th graders, I utilized alphabetical order to provide students with a comprehensive overview of 26 public health topics, which you can see behind me. Then, for each topic, I supplemented the scientific information with eye-catching graphics and interactive activities to enhance student understanding of the material. Using my fellowship grant this summer, I worked with a translator to publish a Spanish version of my book. I printed 500 total copies of my book in English and Spanish, and I donated them to various community centers, such as the OC Rescue Mission, Chalk Children's Hospital, and Corazon de Vida, which is an organization that visits orphanages in Mexico. Along with distributing my book, I also taught public health summer camps with a team of student volunteers. First, I partnered with the Santa Ana Unified School District Engage 360 program to offer a week-long public health camp for their young students. Then, I partnered with Girl Scouts of the USA to offer a virtual public health workshop series for their nonprofit troops. In all, my team and I worked with 120 students. For each day of these summer camps, we had a specific theme. On the first day, we discussed the difference between public health and medicine. Then, for the following days, we delved into more niche topics, such as infectious diseases, brain and mental health, and food safety. We also incorporated fun, hands-on activities, such as mask decorating and mock World Health Organization conferences. To measure my impact, I administered a pre-survey and post-survey to all students at the beginning and end of each summer camp. I found that 96% of students gained more knowledge about public health, and 89% of students expressed continued interest in learning more about public health. Beyond this obvious impact, teaching public health to young students also gives rise to a paradigm shift in health education. Teaching just one student about public health topics creates a ripple effect, helping to educate their entire family and wider community. This transcends socioeconomic barriers. After seeing the success of my lessons, I was invited by the principal of a local elementary school to develop my book into a year-long digitally based public health curriculum that will be adopted by schools in their district in the upcoming weeks. This curriculum also includes a teaching guide and script so that teachers with little to no public health training can easily incorporate these lessons into their classrooms. In the future, I hope to get this curriculum implemented into more schools across the nation. Speaking of future plans, if I were to receive the additional $5,000, the majority of my funds would be directed towards translating my book into more different languages, such as Chinese or Braille. Although there is currently a digital curriculum available, those who are most in need of public health information likely do not have access to technology. The final piece of the public health puzzle is advocacy. This July, I spoke at the Santa Ana Unified School District Board of Education meeting to encourage incorporating more public health instruction into their elementary schools. With the current pandemic, public health education is needed more than ever because many elementary school students are not able to get vaccinated for COVID-19 yet. So the best way to protect them is to teach them how to practice preventative measures. For my next step, I plan to speak at the California State Board of Education to advocate for the amendment of existing elementary health education to include more public health standards. Through long-term curricular and policy change, I hope to democratize public health education for all, so no one else has to go through what my grandmother did. Thank you everyone for your time tonight, and I would like to give a special thank you to Principal Churnside and Mrs. Pennant of Heroes Elementary School for all the support and opportunity you have provided me with, and everyone at Girl Scouts of Orange County for your continued support and encouragement. Let's work together to make the world a healthier place, and please vote for my project.
Wow. Okay, I have to go first. First of all, Daniel-san, where have you hit the teleprompter? I keep looking for it. Amazing presentation.
Thank you.
Please, when you get out of college, call my company. We'd love
definitely.
We'd love to have you join
honored.
us. You're right, there is so much lack of knowledge about what could go wrong, what to do about it, and I've seen surgeon generals of our country push for that. But to have you realize that and go after it, it's incredible. One of the areas that is really important for me is the number of mistakes that are made in hospitals that hurt people. It's the third leading cause of death in our country, medical errors. And if people knew more about their health, more about what could go wrong, they could be part of the team that takes care of them, and they could avoid those. So I think improving people's understanding of health and what do you do about it and what could go wrong could really save many, many lives. So congratulations for going after this. My question to you is, yeah, I think they should teach this in every school like they do resuscitation. At what do they do? It's 7th grade, 8th grade, they teach us that. How can you get this in every public school? Have you thought about it? How do you push it out? How do you really scale this?
Yeah, so I'm starting with the digital curriculum that's going to be implemented in the local school district this fall. And once it's piloted this fall, I'm going to really encourage the teachers to use word of mouth and encourage their teacher friends or principal friends in other elementary schools or even other districts and states to also use the curriculum. I'm also planning to advertise the curriculum in things like teacher forums or teacher Facebook groups to make the material really accessible for them to access. And also, like I talked about, I'm planning to try to push for legislative advocacy change. Policy change takes a really long time, but I think it would be really great if every single state could incorporate, a public health standard in the current health standards they have now, because that would be really effective at requiring all the schools and all the teachers to teach public health.
So that, so my question, and also I echo Joe's comments. Obviously, this is you hit him right, where his heart is, literally. So you just touched a little bit on sustainability. I'd like to talk a little bit more about that. So obviously, advocating at a high level in terms of the public education system is one way to advocate for your idea. But in terms of your exact project, what would be the next most important steps for your work to be sustainable and to grow from its current base that you have with the one elementary school?
I had a team of student volunteers who helped me with the summer camps this summer, so I definitely want to start like a chapter system where I could train high schoolers and college students to host their own public health workshops and summer camps in their own communities. That would definitely spread the word to more teachers and schools and community members about the importance of this project. And I also want to get my book distributed more widely because, like I said, there's currently a digital curriculum, but especially for people in those most underserved communities who need this public health information, they likely don't have access to technology. So I definitely want to continue printing hard copies of my book and translating it into more languages so even more people can understand it.
And what age group is the book currently? What's the sort of the target age group for your current book?
My current book is targeted towards elementary students, upper elementary, like 3rd through 6th grade students.
Have you put any thought about, do you have any ambitions about creating versions of this for other age groups as well?
Oh, yes, of course, like for middle school and even high school students and even adults, because I know a lot of people weren't able to get this education when they were in school. And I also really want to make second editions of my book because this one I was able to cover 26 topics, but there are still so many more.
Right. Thank you.
Do you think that this hasn't been implemented in schools because, why do you think that actually is the question? Why hasn't this been done already? I mean, other people.
I think it's,
Are you the
sorry.
first? Sorry.
I think a lot of people don't really know what public health is. A lot of the teachers, even though they were adults, they weren't completely sure what the difference between public health or like general health or medicine was. And also I think a lot of education policymakers underestimate students and what they can learn. Right now, when I studied the current health education standards, they only teach a couple of things like nutrition, brushing your teeth, getting exercise. But from my experience working with these kids in workshops, there's really no limit to what they can learn as long as you present it in an accessible manner. So that's what I think a lot of policymakers are missing out on because they've never tried it before and they just underestimate what kids can learn and what they're capable of understanding.
So my basic question then, because this is genius, I mean, obviously everybody sees that. I'm just wondering, what do you think's stopping these policyholders from believing the way you believe?
I think it's definitely going to take more than one person, more than me, just telling them to believe it. I think it's going to take some like trial runs, piloting of curriculums to really show them results. With the piloting of my curriculum, I'm also implementing like a pre-test and a post-test. So after it's implemented in this first district, I can present this information to policymakers and the Board of Education to give them measurable results that this is something that actually works.
You're amazing.
Thank you.
You're crazy. Wait, don't go anywhere.